How common is ectopic pregnancy? If you're wondering how often ectopic pregnancies occur, you're about to get some important insights. Let's break it down step by step. First, an ectopic pregnancy is when a fertilized egg implants outside the uterus, usually in the fallopian tube. This can't support the growth of the embryo and is a serious medical condition. Ectopic pregnancies are more common than you might think. They occur in about 2% of all pregnancies. To put that into numbers, for every 1,000 pregnancies, around 19.7 are ectopic, based on data from North America. Over the past few decades, the number of ectopic pregnancies has increased significantly. In 1970, the rate was about 4.5 cases per 1,000 pregnancies, but by 1992, it had risen to 19.7 cases per 1,000 pregnancies. This increase is partly due to better diagnostic techniques, which help detect ectopic pregnancies that might have gone unnoticed in the past. Ectopic pregnancies are more likely to occur in certain groups. Women over 35 years old and those from non-white ethnic groups are at a higher risk. For instance, the risk is higher for Black women compared to white women, with the rates being consistently higher for Black women across different regions. Despite the increase in ectopic pregnancies, the good news is that the case-fatality rate has decreased. In 1970, there were 35.5 maternal deaths per 10,000 ectopic pregnancies, but by 1989, this had dropped to 3.8 deaths per 10,000 ectopic pregnancies. This decline is due to improved medical care and earlier detection. In terms of age, the risk of ectopic pregnancy increases as women get older. Women aged 35-40 for years have a higher risk compared to younger women. However, it's important to note that up to 50% of people who experience an ectopic pregnancy don't have any known risk factors. Ectopic pregnancies are usually detected early in pregnancy, often around the first trimester, typically around 8 weeks. Healthcare providers use various tests, including pelvic exams, blood work, and ultrasounds, to diagnose ectopic pregnancies. In summary, ectopic pregnancies are relatively rare but serious and more common than they used to be. Understanding the risks and knowing the signs can help in early detection and treatment, which is crucial for saving lives.